everyone. Are you still remember the story about my grandfather I shared last time? It's my family experience about hospice palliative care. Tonight, before we start our talking, let's briefly interpret the data. How the pregnancy in the care? Well, continually increasing, right? Then, if I told you, behind this data, it means there are more and more people willing to accept the concept hospice palliative care. What do you think? Today, my topic is hospice palliative care in Taiwan. My name is Wendy Shi. The core value of hospice palliative care is we want to avoid 4 losses. Based on these 4 foundations, there is a 4 strategies on clinical practice in Taiwan. Poor people. We not only emphasize reduce the pain for the people, but also encourage people to advance communicate with their family. What is a good day? Poor family. We care the psychological condition of the family from the time when patient got sick until after they passing away. Poor team. In order to complete this strategy, besides doctors and the nurse should be included, nutritionists, psychologists, or even religious beliefs should be put into together to make effort. Whole process. We hope to spread this idea more earlier than the time we really did it. But when we want to spread this idea in Taiwan, we encounter some barriers. There are 3 common myths in our society. Many people think that if I receive hospice palliative care, it means I have to stay in a small unit to wait for days, and I don't have any chance to go home anymore. But actually, any medical treatment are not passive. They are all curative. Even when we choose no CPR, no electric shock, no intubation, we still stand on the same point because we care what the patient wants and how they feel. Moreover, hospice palliative care is not limited in the small unit. It can be in your home, the most familiar place of you. Most important, we should know that any medical treatment can extend our life, but it cannot postpone the truth of facing death. Next, let's talk about how we promote this idea in Taiwan. Ms. Zhao is a professor who retired from the Department of Nursing in NCKU several years ago. She also is the director of Hospice Foundation in Taiwan. She been regarded as the mother of hospice palliative care. Every year, she writes many books and delivered plenty of speech to spread the idea of hospice palliative care. And after I searched more data about this aspect, I find the true meaning of hospice palliative care. Besides emphasize death with dignities and deal with the problem of decision making, hospice palliative care provides us the chance to save love in the second life. Under the serener atmosphere, everything in front of days becomes so teeny. We want to feel gratitude, we want to feel no regret. So we cherish the time to save love in the second life. Last but not least, the price of life in our terminal life is not for immortality, but for peaceful living. This is my grandfather. He told me the meaning of hospice palliative care. Now it's time to return to our origin. Hospice palliative care. What do you think? My name is Wendy. Thanks for your listening.
Thank you, Wendy, for the presentation. Now let's